Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We have traveled a long distance and we have discussed various karma, their clinical indication, and how to choose a perfect dravya in these clinical conditions. Hope you have understand and you have enjoyed our series so far. Now we are moving towards the clinical application of Rasavichar. Before starting, always remember, in my view, each and every shlok in Ayurveda has got some clinical touch or clinical importance. The question is how you elaborate or you search the clinical application of that shloka in your patients. And to explore this clinical application is aim of this series Clinical Ayurveda by Dr. Mayuresh Agte. Why I am saying you, when we are going to discuss Rasa Vichar, each and every shloka regarding rasa of each rasa about shad rasa, among the shad rasa has got clinical importance. You will say yes, there is karma which are important, there is atyo lakshana, they are clinically important, no doubt. But in the grantha or text, they have mentioned the lakshana of each rasa by which we can identify that this is madhur rasa, this is tikta rasa, etc. They also have a great clinical importance. It is our aim to use or apply these lakshana of rasa in patients in proper clinical way. I will explain in detail this point when we are dealing with the rasa. So let us start with madhur rasa. What is the panchabhautikatva of madhur rasa? It is Prithvi and Jalapradhan. And what is the lakshana mentioned in the text? Tesham vidyat rasam swadu. Vidyat means identify or to know. Swadu, madhur ras. How you will identify that this dravya is of madhur rasa? Tesham vidyat rasam swadu yo vaktram anulimpati aswadamano dehasya ladamaksha prasadanaha priya pipilikadinam. This is the shlok from Ashtanga Hridaya. So, Tesham Vidyat Rasam Sadhu Yo Vaktram Anulimpati. What it means? Vaktram means Mukha, Anulimpati means it forms lepana or coating. Now, when you eat some Madhur Dravya, it will form coating inside the oral cavity. This is a simple meaning. Now, is this symptom can be applied clinically and in which patients? Let us elaborate this thing. Now, Vaktram Anulimpati, it means it is going to form a coating inside the oral cavity. So, in which condition it will be useful? It will be useful in the condition when there is dryness of mouth. So, whenever there is Trishna, you can use this Lakshana as a treatment and ask the patient to chew the Madhur Ras. In this condition, always remember you have to chew it and not to swallow it because we require local action. So, in the summer season, hot season, there is Trishna, and if you are traveling or you don't have any time, every time water with you, this Vaktram Anulimpati Lakshana is useful to treat that Trishna Lakshan. When Trishna is a Vyadhi, of course you can use it in that way, but in normal way also, Vaktram Anulimpati is useful in Trishna. Now, I will keep one aspect in front of you and I will be happy to have your opinion in this regard. When Trishna is a Vyadhi because of or either because of heat, it is Vaktram Anulimpati. so we can use it. It is very easy to understand. But there are some diseases where Trishna is a major symptom. For example, when there is amanirmiti, there is Trishna. In the udara, in prameha, in the jvara, in all these diseases there is Trishna, there is Agdimandya and amanirmiti. Like in udara, jvara or amanirmiti. In prameha there is Trishna, but there is also Madhuras is contraindicated because itself is a prameya is of that type of disease. So, in such diseases, Trishna is a major symptom, and in Udara it is difficult to drink water, it is contraindicated. In Amaja Trishna, you have to drink warm water only. In Jora also that one, but until and unless that Amandirmiti or Ampachan happens, the patient is suffering from the Trishna Lakshan. In such patients, though Madhuras is contraindicated because of Agnimandya and Amandirmiti, or in Prameha it is contraindicated, to reduce this Trishna symptomatically, can we use Madhurasa Dravya in a very small quantity and just make the use of this Lakshana, Vaktram Angulimpati, to reduce the Trishna as a symptom in this patient. In my practice, I generally use this Madhur Rasa in very small quantity and use Vaktram Angulimpati Lakshana to reduce the Trishna for that patient. So, need of water or suffering from the very high intensity thirst is relieved. This is a symptomatic treatment, but it is useful. So I will be happy to have your opinions. And again, you have to not chew it, you have to swallow, not swallow it, you have to chew it, and again in a very small quantity, so it will not increase the samprapti which is related to Agni or samprapti of Prameha. This Vaktram Angulimpati Lakshan is very useful in the sports person because, for example, cricket, they have to play in the sunlight or high floodlights or any sports where there is constant sweating and they require water for the thirst, which is uh, because of their activity it is formed in the body. So it is not possible to drink every moment the water. So in this sports person Vaktram Angulimpati, you can ask the sports person to chew Madhur Rasa. So during the play, the thirst which is formed in the body is in control. Now this coating or Angulimpati is useful in another condition which is called as mouth ulcers, because the ulcer is healed when there is a layer of Madhur Rasa Dravya over it. So this is another condition that Vaktram Angulimpati Lakshan can be useful. In many cancer patients of oral cavity, they are operated or mainly they are, if they are given radiation, there is severe burning after the radiation because of the rays which are used in the radiation therapy. In that case, to reduce the burning, and also there is dryness of mouth because of that area is burned. In that case, to reduce the burning and dryness, Vaktram Anulimpati Lakshan is very useful, and ask the patient to chew Madhur Rasa Dravya like Yashti Madhu, Khadi Shakkar or sugar, even like chocolate, to have coating inside the mouth cavity and to relieve this symptom. We will come with other symptom of Madhur Rasa in next episode, but only this Vaktram Anulimpati Lakshan which has been given in the text can be used in this variety of diseases as a treatment. Hope you have liked this episode. Please subscribe and forward to your friends. Thank you very much. In next episode, we will continue the same discussion. Thank you again.